Time now for a look at your health. Millions of Americans suffer from this disease and they don't even realize they have it. In fact, the CDC considers it the #2 public health enemy behind tobacco. We're talking about high blood pressure, and here to talk about risk factors and symptoms is Dr. Mitchel Goldman from UCSD. Thank you for being here.
Good to be here.
So, left unchecked, how serious of an ailment is this?
Actually really serious. It will increase your risk of stroke 4-fold and your increase of heart attack 3-fold. So it's a very dangerous condition, and left unchecked it can actually start to degrade and destroy your kidneys as well. So stroke is, high blood pressure is something we really need to look for.
And this is a widespread problem in the U.S.
It really is. 67 million Americans have it, and half of them aren't even treated properly. Of that number, 16 million Americans don't even know they have high blood pressure.
All right, so this is probably a myth-buster moment because I am under the assumption that it's mainly men who get this. Is this an equal opportunity offender, or?
It really is. Now, there are a number of factors that increase your risk. Being African American, being obese, drinking too much, having too much alcohol. You know, those are the common factors that cause, of course, a family history, if you have diabetes, and of course, cigarette smoking. So those are the things that will put you more at risk for high blood pressure.
So either gender is susceptible, for sure.
It really is. This is not a male or a female thing. It's basically the more stressed out you are, the more you don't have a healthy lifestyle, the more likely you are to have a high blood pressure.
Now, there is a particular type called malignant hypertension that is more dangerous than others?
Yeah, it actually can be fatal as well. That's when your blood pressure becomes very high, usually for another reason, not just the obesity and smoking, but because there's a medical condition. We can have different tumors of our adrenal glands that release a lot of hormones or thyroid, and what that does is it actually increases the blood pressure. You have severe headaches, and actually it can cause a lot of very serious problems.
And we're looking at the symptoms of this, and there's a lot of things on that list that I might think I just am coming down with something.
It is. A lot of it is flu-like, but the key thing here is nausea and vomiting with severe headaches, and that's a problem, and you just feel more jittery.
So what can we do to try and limit high blood pressure and hypertension?
You know, Kathleen, it's what we say almost every Tuesday night. Don't smoke. Limit your alcohol to 1 or 2 drinks a day. Try to maintain a healthy lifestyle, exercise, keep your weight down. But with blood pressure, try to stay away from the really salty foods. So that's another thing we need to watch out for.
Let me just leave our viewers with this thought. How much of this is genetics?
A lot of it is genetics, but it's not all genetics. We can't blame this on our parents and grandparents.
Darn.
I know. This is on ourselves. So as long as we maintain a healthy lifestyle, we're going to do okay. But you know, when you see those free blood pressure cuffs in the supermarket or the drugstore, sit down, take a free test, because again, 16 million Americans don't realize that they have high blood pressure, and the treatments are not that difficult. So if you do have high blood pressure, please go see your doctors.
All right, Dr. Mitchel Goldman, thank you so much.
Good to be here.
Lauren, always good advice from Dr. G, and of course, especially about this, because you can be a ticking time bomb.